Hello, everyone, and welcome to our breakout session, Student Advocacy Implementation of Programs. Throughout the session, you can send any questions that you have for the speaker in the Q&A tab, and they will be discussed at the end of the presentation. And now it's my pleasure to introduce our speaker, Candace Sapp. Candace is a first-year doctoral student in the Community Nutrition Program in the College of Education, Health, and Human Sciences. Candace serves as a maternal and child health nutrition leadership trainee with Marsha, Spence, and Betsy Anderson-Steeves. She works with Dorian McCoy as a graduate assistant on diversity, recruitment, and retention initiatives for CEHHS in the Office of Diversity, Equity, and Inclusion. Her research focuses on the implementation of nutrition interventions related to childhood obesity and minoritized youth. In her free time, she enjoys baking and decorating cakes. Please join me in welcoming Candace.
All right, hi everyone. My name's Candace, like Natalie already introduced me, and I am going to be presenting on implementation science today. So I know the agenda said I would be presenting on implementing programs, but I'm actually going to talk about how implementing interventions and implementation science are actually a little different. So since this is a breakout session, please feel free to talk throughout. Like if you have any questions, just stop me. You don't have to wait until the end of the presentation. Just feel free, I guess, to just unmute yourself and speak up. I'm gonna go ahead and start sharing my screen. So like I said, I'm going to be talking about implementation science. And so throughout this week, you've seen different tools and programs that can be used to promote healthier lifestyles. In particular, you might see some that can assess and promote like walking or biking or assess the healthiness of a campus or a community environment. So with that in mind, I'm going to talk about how implementation science can be applied to public health and specifically nutrition. So implementation science is the study of methods to promote the adoption and integration of evidence-based practices, interventions, and policies into routine healthcare and public health settings to improve the impact on population health. So the goals of implementation science, we want to start by identifying barriers and facilitators to evidence-based practice acceptance, adoption, adaptation, dissemination, and sustainment. And so then you want to develop and apply strategies that minimize barriers and or amplify facilitators. So one key thing about implementation science is that you're going to see the term strategies a lot, or sometimes approaches. So then you want to promote evidence-based practice, uptake, and sustainment in real-world settings. And finally, you want to, minimize the gap between knowledge and practice. So another key element of implementation science, sometimes you'll hear like being called mind the gap. And what that means is that often you see the theory as knowledge and the application as practice. And there's usually a gap in between those two things of like what theoretically should be happening and what actually happens in the real world. And implementation science is working to bridge those two and really reduce the gap so that ideally the theory and the practice match. Okay, so why is implementation science important? So it takes approximately 17 years for evidence-based practices to be incorporated into practice and community settings. Approximately half of evidence-based practices reach widespread clinical use. So what that means is that like in academia, we spend so much time developing interventions, but there's a chance, and actually a large chance, that all of these interventions that we develop may never make it to like outside of that bubble. So they'll never make it to real world settings. So most studies reporting intervention effectiveness are not truly translatable to practice settings because they're conducted in such controlled environments that when you translate them into real world settings, they may not be as effective as reported in the literature. So there are so many sciences that overlap, and sometimes implementation science is called other things, or sometimes people refer to what they're doing as implementation science when it isn't necessarily that. And it's not that any other discipline is wrong, it's just different. And so it's sometimes good to really understand what implementation science is and is not. And like I said at the beginning, there's a difference in implementation science and implementing an intervention. So with that being said, there's implementation science and there's also intervention science. So intervention science focuses on program efficacy and or effectiveness. And so then there's also evaluation science. And evaluation science judges whether programs and policies are valuable, effective, and efficient. So that might sound like implementation science, but the difference is that implementation science isn't necessarily judging the program or the policy, but assessing the strategies used to implement the programs and policies. And so then there's also dissemination science, and that's dissemination science emphasizes the sharing or spreading of information. And implementation science looks at dissemination, but implementation science looks at the strategies used to disseminate, not the actual dissemination itself. And there's also a quality improvement. So quality improvement, sometimes called QI, typically starts with a problem and creates programs and strategies to improve the problem. So it can be similar to implementation science, but still not the same. So key components of implementation studies is that they're typically larger than just the individual or patient level, or sometimes since we're talking about HCRC, it's usually going to be larger than just the student level, right? So the studies, they're going to study like the provider, the facilitator also, and also the organization and policy levels. So when you think about an implementation study for campus health, you might see something that studies the students, but also maybe the faculty and staff, and then the facilitators who are implementing interventions, and also maybe the campus as a whole, or even departments, and then like looking at the community too, and the policies that impact everyone. So it's a very transdisciplinary and interdisciplinary science. So often you'll have sociologists, anthropologists, economists, organizational scientists. You might have like behavioral scientists, nutritionists, but you'll have lots of different people on the team, hopefully, if you're doing implementation studies. You also want to have community stakeholders and partnerships, because what we know is that you want to have the community at the center, and whoever is the priority audience, like they should be part of the interdisciplinary team. And there's a lot of models and frameworks that are already been established and used in implementation studies. So you don't have to recreate the wheel. You may use an already established implementation framework to identify strategies, and you may want to improve them too. So implementation science and health promotion. One thing that implementation science can do in health promotion is identify barriers and facilitators to achieving program outcomes such as behavior change. Something that we see a lot in health promotion and wellness and nutrition, physical activity, any of those factors related to health promotion, is that sometimes you'll see an increase in knowledge, but not a change in behavior. And so implementation science is not necessarily concerned with the actual outcomes, but looking at the barriers and facilitators to those outcomes. So some of those barriers and facilitators could be recruitment or like retention or program facilitator factors and sustainability. So when we talk about recruitment and retention, I think maybe start asking questions like this when you're designing new interventions or you're evaluating your intervention. Are there any barriers or facilitators related to recruitment methods? So thinking like the way I recruited participants, am I introducing some sorts of bias to the recruitment process, or like what type of participants are going to join because of the way that I recruited them? Or are the recruitment methods so labor intensive that that's going to affect retention, or who would want to do this? Would my recruitment methods need to be adapted for interventions tailored for specific cultural groups, and not just cultural groups, but just priority groups? So say a tool was developed for college students in an urban setting. Maybe the recruitment methods that were used for that study would have to be adapted if I was implementing the same study in a rural setting, or with the HBCU, or with other minority serving institutions. What factors affect program retention once disseminated? So this is really important when it comes to sustainability. What you can do to improve retention, especially like during a pilot, may be different than when you disseminate something, because now you may not have the resources of the university or academia to support it. So like being mindful of like the programs that we design, can they be implemented when we remove the resources, such as like academia? So, and also like this is a question that I like to think about a lot when thinking about programs and like interventions, and that's incentives. So a lot of the interventions provide participants with financial incentives. Well, the issue with that is that in the pilot stages, or even when you're doing these RCTs, the randomized control trials, you may be able to provide financial incentives. But when you roll this out and you disseminate these programs, can you still provide financial incentives? So say you're doing the FRUVE program. Well, in the studies that are published, participants may receive like $20 or something to participate. But if universities just decide to implement this program on their own, can they actually provide financial incentives? And also, do the financial incentives impact outcomes? Like without the incentives, would participants still participate, and would they care as much? So think of things like that. And I can't really see anyone while I'm presenting. So like I said, if you have any questions, feel free to stop me as I'm going. So you also want to look at the program facilitator. How do program outcomes differ when community members and non-university personnel facilitate the program? So for example, think of a cooking intervention. When you have like nutrition professors and nutrition graduate students implementing the program, are the outcomes different than when you actually have community members, paraprofessionals, non-academic people implementing the intervention? And it's easy to think, well, okay, maybe the outcomes are different because, like education levels. But there's other reasons why the outcomes will be different. For one, when you're doing like a controlled intervention versus like dissemination, a lot of times the personnel are allocated to that study, right? So like say it's a graduate student, they may be paid just to do that intervention, versus if you're expecting extension professionals to do it, this is something that's on top of their regular job role. So how is that going to impact their ability to implement these programs and also the outcomes of it? Also being mindful of like facilitator and participant match. So does race and ethnicity match play a role in program outcomes, and not just race and ethnicity, but maybe gender, sexuality, like age, language, like being mindful of those things that like it may be important to have a facilitator that matches the demographics of the participants. And I kind of talked about this earlier, but when you disseminate programs, do the people that you're asking to implement this intervention, do they actually have the time and the capacity to do it? And will it be done the same way because of limited time and capacity? And then are there plans on the front end to ensure that all facilitators have similar knowledge and skills? So if you're implementing a health promotion program, you don't want to have one campus where the people who are implementing it have a master's in public health and another campus where they don't have any background in this, but you know they're paid to do it. So like you want to make sure that the facilitators like are held to, I wouldn't say the same because that's not always realistic, especially in the real world setting, but to like similar standards. Okay, and so sustainability, and so often sustainability is just looked at from like an environmental standpoint of like how will this impact the earth. But I also think that it's important to think of sustainability as emotional and mental sustainability too. So of course, are free health promotion programs feasible for campuses and community organizations to offer? You know, when you start, you might be offering like a cooking program for free for participants, but for an organization to keep doing it, they may need to charge. And if they're charging and maybe your priority audience are low income individuals, like, is that realistic? And then also thinking of things like, do the interventions and programs that we design, do they actually positively impact basic needs? Or are they just impacting knowledge? And not that knowledge isn't important, but if we are only targeting knowledge and not addressing basic needs, then we can be missing the mark. And then research shows that programs need to be at least 12 weeks to have long-term effects, but the longer the programs, the more costly they are. So like, how can we create longer, more effective programs without them being so expensive? And also, is the program success dependent on researcher support? But another aspect of sustainability I like to think about is, am I demanding extra work from people who are already unfairly taxed? You know, so like so often interventions and programs are asking for behavior changes and individual level changes from people who have already been historically marginalized and oppressed, instead of really targeting policies and organizations to change. And so just being mindful that like sometimes our interventions are not emotionally sustainable because we're asking so much and too much from people who are already doing a lot. And so I have just some examples of implementation studies. So I can provide links to people later because you can't click on any hyperlinks for this, but these are talking about factors influencing the efficacy of nutrition education interventions and factors that contribute to effective nutrition education interventions. And like, you know, so like I said, you see the term factors a lot, or frameworks. So I'm going to try to close out of this. Click to exit. Okay. All right. So I'm just going to open up the floor because at least I got the view of it, like since this is a breakout session, that this is a good opportunity for us to talk about implementing interventions and implementation science. So I'm going to make sure I give the audience plenty of time to speak to. And actually I have a question for, I think, Natalie, like how do I stop sharing?
You should be able to click the share button again.
Okay.
And it should remove your screen.
All right, awesome, thank you. So I see that we have 3 other people here. Do y'all have any questions about implementation science or implementing interventions, or I don't know, like thinking through some of the programs that you're hoping to implement, like from like a sustainability viewpoint or anything? All right. Does anyone have any suggestions for how we can implement interventions better in the future?
So I do see Angelica's question. I can't give the ability to unmute, but we could bring her to the stage and then she would be able to use video and microphone. Would you be okay with that?
Yeah, definitely. I'm sorry. I thought that everyone could unmute and like speak. I'm sorry.
Well, that's okay. All right, Angelica, I'll give you an invitation to come to the stage so that you can share your feedback with your camera and mic.
Hi, I'm sorry. I was having trouble trying to figure that out.
It's okay.
But I'm quicker in speaking than I am, I guess, writing a question out or just giving feedback. But really what you said at the end, hopefully you can hear me all right. Can you hear me all right? Okay.
Yeah, you're perfect. Yeah.
What you said at the end really resonates with me when you're saying, you know, adding that it's like an additional burden to sort of the communities that may need our help the most. And even in the case of like college campuses, right? Particularly maybe those that are more at risk for like food insecurity or poor health behaviors have that added burden. So do you have, I guess I don't know if I really have a question, but do you have any thoughts on how to make implementation with these sort of populations reasonable and sound, and kind of maybe reducing that burden or not creating a burden at all, and hopefully enacting some positive change?
Yeah, I think one thing is just being really sure that we are centering the needs of the groups that we say we're focused on. Like, so often I think we conduct research on people instead of conduct research with people. And so like if we're doing research about college food insecurity, we need to be sure that there are college students experiencing food insecurity on the research team. And I think so often we call it community-based research, but what we really do is we go to the community after we've already made decisions and say, like, are you okay with this? And that's not really community-based. Like, if faculty members have already made decisions on what they're going to do for students and then they take it to students, it's too late, you know? Like, I think students should be involved in what do you think would change your food security situation, and what would you like to see done? Because for one thing, if I, as a college student, have a say in it, I'm more likely to participate. But also, I think college students will have a better sense of what's too much. Because like I'm not sure, Angelica, if you're a student or faculty or not, but like I know for myself, I'm a grad student, and there's always extra ask of us. And it's like if students tell you, and something I've heard over and over today and yesterday, that one of the biggest factors of healthy lifestyles is price, it's money. So if students tell you we're not making enough, but researchers say, well, here's an education program that you can participate in, then you're not listening to me. Like, I don't need another education program to educate me that I'm food insecure. I need more money. Like, so I think like it's really important to listen to people and to go in there honestly. Like, if we're not starting research from the place of, I actually have an intention to design research that these communities want to have, then we don't need to do the research. You know, like if we go in saying, I'm going to do the research that I'm passionate about and they better get on board, then that's kind of a problematic way to do it. And I think it's also really important to like take the time to acknowledge our own like privileges and biases when conducting research. Like there, I think Jade made a really good point when she was presenting earlier that what students perceive as barriers to health and facilitators to health is very different than what faculty and researchers perceive to be barriers to health and facilitators. So like being mindful that like researchers, we don't know everything. Like we're not the experts on everything. People are the experts on their own lived experiences. So I think that's really important. I think just like having a more like systems minded view. So like my personal research is using like system science approaches. So like understanding how not just community, but like policy level decisions impact people's decisions, like everyday consumer purchases. And that the truth is people don't make poor decisions a lot of times just because they want to. It's like they're part of a wheel. And like a lot of times these individual level decisions, like in interventions we're trying to implement, they don't have as much impact as we think. So like, I think it's good to try to challenge systems and bigger players instead of always asking students to be the guinea pig of an intervention. Like maybe the intervention could be challenging department heads to increase their student stipends. Like the intervention does not have to be students have to take a cooking class every week. Like students didn't ask for that. So I think that's important to keep the I don't like to say the target audience because it sounds like you have like a circle painted on someone's back, but keeping the priority audience in the center of every stage, not just like using them as a like a sounding board when it's convenient.
Yeah, oh, you're preaching to the choir. I think the exact same way. That's kind of what I wanted to chime in. I am a graduate student just the same. I'm not that far removed from undergrad. So I'm really familiar with that. You and I both, I imagine, right? And so you're right, like it is very different from what we're trying to achieve or what we're targeting versus what is going on in their heads, going on in their lives, what they prioritize. Just today, I'm part of the Rutgers group, so I work with Carol Breadbenner, and we do not aside from the college campus work. My dissertation work is in childhood obesity prevention, and we have materials. And this morning I was dropping them off to the WIC clinic in Newark, and like I mean I've been firsthand in that kind of space, but I felt kind of ridiculous walking in with like these materials kind of promoting just like more, get better sleep, get more exercise. It's really, it's fallen on deaf ears because these people have larger issues at hand or more important priorities, like their work status, who's taking care of their child. You know, nobody's focused on like, oh, let me make sure we're all getting 8 hours of sleep tonight.
Exactly.
But hopefully, next, you know, it improves as time goes on, and it is a larger issue, a lot of it, and I look upwards of it, right? Like you said, policy level really is, you know, if you were to increase stipends, if you, I kind of thought about this earlier. I think yesterday I was in the food insecurity outbreak, and we were asked like, what are some programs that we have in our universities? And at Rutgers, we have like a sort of like a small scale program where you could donate like your what is it called? Your food swipes, your meal swipes, but you can only donate your guest ones. So every semester you only get 10 guest swipes. So I haven't had a meal plan since like, I don't know, 7 years ago now, I don't know. But I would end up with like 100 swipes because, you know, my parents bought me whatever package.
Yeah.
And there's people that just have nothing left.
Yeah.
Don't even realize that they're food insecure, pretty much having like that, going through that college struggle, sort of like for the character development.
Yeah.
But I can't even offer them some of the meals that I won't even be able to have. And I just feel like it's not any major ask, or even stealing a piece of fruit from the dining hall. People would get in trouble. From when I was, you know, an undergrad. Maybe things change. I really doubt it, but it's like such simple, large-scale implementation that would create such a change with little to no work.
Yeah. I mean, I don't know if it's different at Rutgers, but like at UT, grad students don't even get a meal plan included with like our stipend. You would think that would just be like a basic thing. And it's actually something that a lot of the nutrition students like complain about, because it's actually kind of frustrating to be part of research groups that are doing research on college student food insecurity. And we're like, do y'all know that we're food insecure? Like we are your study participants. Like,
yeah.
How insane do we look?
Yeah.
Like asking people questions on a survey, and it's like, you do know our stipends are below livable wages, right? So it's actually kind of
tell me about it, especially here in New Jersey. I'm just like, I don't know if I could afford moving out just yet. And it's like,
exactly.
That's a world or nationwide issue, definitely, but
yeah.
definitely on our campuses and for us ourselves, you know?
It's actually kind of funny, because it's like there are very simple but specific ways that food security could be addressed. And I think part of it too is that in academia, we can get really out of touch with real people. And so when your bubble is just people who are high earning individuals and very highly educated, you forget the real struggle of being like a normal human. Like,
yeah,
if you
even
ask,
if you're going through it,
and it's not a bad thing. And like, I don't think that people should be ashamed of their privilege. I think it's a good thing that you have these privileges, but just being aware that like your lived experience is not the same as your students. Like, most faculty don't have to think when they go to the grocery store. They don't have to think like, oh wow, like I have to choose between this food or that food. Like that's just not a common like thing they have to do. And so I don't know. I think like being aware of your privileges, but like making sure that you're centering people, and like also we have to stop being so theoretical too. Like, and be realistic. There are such, like I said, small changes that can make a huge difference. And we a lot of times we look at symptoms, you know, like if you say you're going to a WIC clinic, like nobody gets 4 hours of sleep just because they're like, I don't like to sleep. Like, people get 4 hours of sleep because they're working 2 or 3 jobs, and they're up for other reasons, because they're stressed or you know, like, or sleeping isn't safe. Like, and people don't think about that. Like, I worked in school nutrition before I came back from my PhD, and so many students sleep at school and they get punished, but like teachers and administrators don't understand that they're afraid to sleep at home because they get abused when they're asleep. You know, there's rats and roaches, and like if you stay awake, they won't get to you. But if you're sleeping, like you don't know what can get to you. So like, or they're watching their siblings, and like if they sleep, maybe their mom's boyfriend will abuse them. Like, so I mean, I think there's just so many issues that like we give someone a handout saying sleep 8 hours, and it's like, yeah, well, I mean, thanks, but I didn't choose to not sleep. So just like eating healthy. Like, no one's like, okay, you know, I want to eat ramen every day. Like that. No, that's what I can afford. So.
And it's a privilege to even consider eating like organic, fresh, raw foods, whatever it is. There's, you know, like you think that we're kind of progressing as a country. Maybe that's just in my head. I feel like we're supposed to be progressing, but we really aren't. And there is still that large separation where, I don't know if you're on TikTok, but I am. And there's just some people that get on there and cook, and they have all this fresh stuff. And it's like, the rest of us can't afford it.
Yeah.
Or maybe we can, and we're not. Or that's the other thing that I find like really interesting is like defining food insecurity and college students. Probably by definition, I've been food insecure in college, and probably most of us have, or a large percentage of us. And I feel like we're not really capturing the nuances of what food insecurity, nutrition insecurity too, looks like in college campuses. It's different than, I know I asked, I forgot her name, but who, the professor who did the breakout for food insecurity yesterday, I asked about the, the USDA food insecurity scale and how it doesn't accurately capture college age students at all, because they're not, you ask them, have you had to forego a meal for your child or something? Most college age students don't have that issue. So we don't really even have like a proper scale. Or even if we do have those scales, I feel like they're still not super nuanced to really know and get to the point of what maybe is a small change that we can make to get even a small percentage of students less food insecure.
And I think you're right. Like, I think a lot of students don't know they're food insecure.
No.
And I do think that there's a difference between being food insecure and nutrition insecure. And I think that's what happens a lot on college campuses, is that I may be able to afford food, but the food I can afford is not healthy. And so then we go into this whole like healthy, like campus research coalition or consortium. And it's like, why are students not healthy, but they're food secure? And it's like, yeah, but maybe they're not nutrition secure. And so it's like you said, it's a privilege to be nutrition secure. It's a privilege to be food secure, but it's a bigger privilege to be nutrition secure, because a lot of times if you are low income, which most students are, you don't have the privilege of thinking, is my food healthy? You're thinking, is my food enough so that I'm not hungry? And I mean, and I think it's a privilege to even get to the point of like health and hunger being on the same level. Because like, I know for myself, I'm not going to choose health over hunger. Like, that doesn't make sense to me. Yeah. And so like the hierarchy of needs are really important. And I think it's just very easy to get away from basic needs and like get into like, oh, let's improve people's knowledge and education. But if you don't improve my resources, it doesn't matter, because I can't actually apply any of the knowledge and education I've learned. So
yeah, that's
yeah. But I mean, like you said, hopefully there will be like more, I don't know, in touch research in the future. And I do think too, like, it's really hard for faculty to realize how little things have changed. Like, one of my supervisors today told me she got her PhD 20 years ago. And she told me like, her stipend was higher 20 years ago than the stipends are right now for students in Tennessee.
Wait, what was the difference? It's the same one? What was the difference?
So her stipend 20 years ago was like $1,200 a month. And that's what we make now.
Wow.
Yeah. Like,
probably how much I make now too. I don't know. I don't even want to do the math.
It is literally below the requirements for SNAP.
And there's money there.
Yeah.
There's always money somewhere that is just not properly allocated. And that's the case with any and every field, especially here in America. I mean, I can't speak for, not every other country, but especially here, definitely here, right? And I mean, hopefully the future is brighter, but who knows? I mean, who would have thought, your advisor or the professor that 20 years ago, they probably thought the same thing. And sure, maybe we reached the point now where we're understanding or finally like tackling issues like nutrition insecurity, right? With the White House summit that they had a few months ago, that's finally coming into the picture. I actually wasn't even, when I went to Fancy, and I actually wasn't even aware, because in my mind, I was like, yeah, I mean, people don't meet their nutritional needs. Like, they might have calorically dense food. There might be Velveeta cheese and macaroni elbows available for everybody and canned soup, but they definitely aren't getting fresh fruits and vegetables, even canned or frozen fresh fruits or vegetables and fruits. but apparently it's just now coming into like the spotlight, and hopefully we do something about that going forward. But I guess that's up to us and those with higher and larger power than us, which we don't even know what it's going to look like moving forward, right?
Just transparency too, like, even like students sharing how much they make, or like even students sharing with faculty, like how difficult like a student lifestyle is when you don't even have the time for outside jobs, and like you're expected to do so much and it's just not realistic. But I don't think that faculty members truly understand like the financial burden of like that students experience. So I do think that makes it harder. So I don't know. And I mean, and this is just my personal opinion, I don't think that food banks and things like that are that great of a thing. Like, I think that is, I guess, a good thing that there are policies and things out there to make food banks available. But I don't think that people should have to depend on charity to eat. Like, I think that it's problematic that people do not make enough money to be able to buy food. Like, yes, it's nice to have a safety net, but for a lot of people, it's not a safety net. It's just their everyday existence. And like safety nets are supposed to be for like emergencies. But like the fact that so many people don't make enough to meet their own basic needs is problematic. And nobody wants to rely on food banks. So like, to me, that's like a really weird solution to a problem. Like when colleges say, oh, we have a food bank. It's like, but I didn't ask you that for a food bank. I asked you for enough money to afford it. Like, that's problematic that your solution to me not being able to buy groceries is that I can go to a pantry down the hallway. Like, that's what I asked.
And even so, these pantries and food banks, while they are improving it, and like I really agree with you and how you say that it should just be a safety net. Like they exist for good reasons, but they should realistically or theoretically just be a safety net. But even so, like they are not entirely convenient, right? I've worked at a farmer's market where we did, we accepted WIC, we accepted senior market, things like that. SNAP, we would double SNAP benefits. And one of the largest, kind of comments at the end of the season is always, you guys aren't around enough. And I can't, like I was a college student. I would have to set up all the tents with, a few other college students. There's not enough staff. There's not, it's just a farmer's market. And some people like heavily rely on that when they're in the summer. And then that resource dries up, or they aren't available at the times that we, or we're not available often enough. We can't be open all the time like a convenience store, like ShopRite. But I don't know.
I mean, I think that's one of the benefits of SNAP is that like you can have some dignity with it. Like you can still go to a grocery store, and there shouldn't be a stigma with food banks. I'm not saying there should be, but at the same time, it's just like also people shouldn't have to exist just on leftovers. Like, and a lot, like I know on campus, a lot of the food banks, they're doing good work, but like this is food that was left over from people who weren't able to eat it. And so I'm glad that's there, but it's just like, do you not value the work we do? Because if you value my work, you would pay me enough to live. And so I think that's like a big thing that like organizations, universities, like policymakers have to think about. It's like, we shouldn't be arguing and begging people to pay us a livable wage. Like if you value the work I do, you should pay me a livable wage.
But it falls on deaf ears, But it reminds me of what I was thinking and I forgot, it escaped me. Like going, you say SNAP benefits, also WIC, right? They give you the checks, but today it really, I've been to, so we have one near New Brunswick, which is where Rutgers is, and there's another Rutgers campus at Newark, and similar but different populations, right? Local populations, but it was like night and day between the two WICs, and I'm thinking, why is that? Up in Newark, it was the most chaotic. Like it was like a tiny, probably the size of this office. I'm kidding, but like a little bigger, and just rambunctiousness, just families pouring out. Like you're not giving these people dignity, and they're just coming here to have enough money or just a little bit more money to support basic needs. Nothing extraordinary. Nobody wants these, like, nobody's asking for organic raw foods. Like I said, they're just trying to meet basic needs. But the difference between Newark and New Brunswick, the location in New Brunswick is out in the middle of nowhere. It's near nothing. It's near a bunch of like large 18-wheeler truck stops or whatever. So why is there's not a lot of people there? Because they can't reach that location. Who's gonna spend the money to get an Uber back and forth? I don't even know if there's a bus stop there. So like, maybe if they were closer, it would be spilling over just like the one at Newark. And it's like, it's bad either way you look at it, because these people, we're not giving people that need these services enough dignity. Like, these resources should be well funded and well established and available to everybody that needs them. Nobody lives near a bunch of 18-wheelers,
No.
And it's likely done strategically, because they know what happens if too many people need those WIC services or too many people are seeking them out.
And people don't like too many low-income people in the same area. Ianu is a PhD student at UT with me. I don't know if Natalie can put like him on the screen too, but it's so crazy.
We are almost out of time. The session needs to wrap up here shortly. So
yeah, that's fine. I'm sorry.
That's okay.
Like transportation is a huge problem in Knoxville. There's only one WIC clinic in Knoxville. So like, if you can't find some transportation there, you're up a creek. And like, we have a lot of international students in our program now. And so they've like shared too, just how hard it is to take the bus, because Knoxville's not an urban area. And so like, it's not like you can just take a bus from here to there and then another bus will be here like in 2 minutes. It's like, if you miss the bus, it's gonna be forever. And so it's so inconvenient, like, to get any resources. So it's just very crazy. Like, and
it all overlaps, and without one, the whole system falls. And so it's hard to get every pillar to where it needs to be. So.
Exactly. And people don't want education on better transportation. They just want better transportation. On like how to bike safely. I just need a bike, like I need a bus.
Yeah.
Like, it's crazy.
That's very true.
All right.
Sorry, Natalie, if we went over.
That's all right. We will leave it here, but you can continue your conversation in this session room if you'd like. So thank you so much, Candace, for sharing your approach and research. The next session starts at 3:40 back in the main room. It will be an activity break followed by research tool presentations.